It's as good as it gets in many respects, but again, can be improved by alternate medical techniques, biofeedback, for instance, that sort of thing. And that's about the story on that.
Do you believe in the placebo effect?
Yeah, absolutely. There's no question about it. In fact, the effect is there and noted on almost any sort of double-blind test. For instance, a double-blind test is a test where you have two classes of patients, A and B, and you have the doctor. And then you have the pills, they all look alike. Some of the pills are specific for whatever they're treating. The other is just a placebo, a little sugar or something. And either side, the patients and the doctors don't know which is which. And then they evaluate it after, say 6 months or whatever the protocol is. And they see that the patients who take the medicine, which has been proven in the past, a certain percentage of help. So does a placebo, maybe more. And a patient who comes in, they want something, they want some treatment. And it isn't charlatanism to give a patient a sugar pill. It's the art of medicine. That patient feels much better. The doctor cares about it. He's giving me something. He's taking care of it. I do feel better with it. So definitely there is, and sometimes a powerful element to placebo. And I think we'll always have placebos because, again, they're part of getting people better.
Thank you.
When people come to see you, do they have preconceived notions of what their condition is, or have they come to you with more of an open mind?
Well, that's a good question. Generally, if you go to your family doctor, general practitioner, I was pain. You don't know exactly what it is. There's something there. It's something in the abdomen. They don't know what it is. Now, I'm a specialist, so the family doctor will say, well, it's your kidney or it's your bladder or so on, or the prostate. So when they do come to me, they have a pretty good idea it's in my department, in genital urinary tract system. I think most people know they're sick, number one. Most of them have a vague idea, but not a specific idea. And that's what they come to the doctor to find out. What's the specifics? Is it bad? Is it need treatment? Doesn't it? And so on. So I think most of them have some idea. Some have a very good idea. I've had heart pain here in the chest and so on, and I'm going down my arm, and I could hardly breathe. Probably it must be the heart. May not be. It could be something else. But this is what they're worried about.
Do many of your patients come to you with the belief that you, as a doctor, have all the answers?
I think probably not. I think most people are smart enough to know that nobody has all the answers. But they think that the doctor has most of the answers, and they certainly hope that all the answers the doctor does have pertain to their particular problem. But no, I'm sure they don't. And they're looking for whoever has most of the answers. And that's why sometimes they'll go searching. They'll see one doctor and get some answers and say, well, I want a second opinion or a third opinion, get more answers. In other words, investigate further, trying to get someone who not only has more answers, but more answers for their specific problem.
In your experience, do many doctors believe that they have all the answers, or do they see diagnosis as more of an art form in some cases?
No, I don't think most doctors think they have all the answers. And I think the reason is because they know they don't have all the answers. They really don't. They know they have many answers, many more than they used to have, or even 30, 40 years ago, even 5 years ago. But they know that they don't have. And there's always personalities. There's always some doctors who may really think they have all the answers, but they're more or less prima donnas, and it's more of their persona. That's the way they are. But they really don't have all the answers. We are more and more trying to get more and more answers with the research and the way technology in medicine has changed. We're trying to get more and more answers. That's medicine has always been doing, trying to get more answers. But no, unfortunately, we don't have all the answers yet. But one of these days, I hope so.
Thank you. Do you feel that it's important for doctors to instill a perception of confidence they may not themselves feel in order to comfort patients?
Oh, absolutely. A patient comes to a doctor and he wants someone who is confident. And frequently, in difficult cases and so on, even though the doctor may not be very confident with the outcome, with the treatment and so on, the patient expects him to show confidence. I mean, this is the pillar that they are putting their trust in. They don't want some wishy-washy physician who is unsure, is uncertain, or who shows unsurety and uncertainty. They want someone who they have confidence in. Even though he may not cure them, he'll be there. He'll help them. He'll do everything he possibly can. Whatever he can't do, or whatever he doesn't know, he'll refer it to somebody. But he's the person they've picked to put their reliance on. It's like the captain of a ship. The ship may be sinking and going down fast, but the passengers don't want to see the the captain panicking. They want to see him steadfast and reliant and doing his very best to the end.
Do you have anything else you'd like to add or any comments?
Well, yes, I think so. I think just the history of medicine is so interesting. When you think of it, medicine really hasn't changed very much up to maybe the 19th century. They were doing things pretty much the same thing. And then suddenly an explosion of knowledge and technology occurred. Things with fighting bacteria caused infections, antisepsis, anesthesia, and then gradually into understanding more the physiology, how the body works, what the metabolism is, how they can operate. I mean, at one time, even the Civil War times, the best surgeon was the fastest surgeon. All he could do was just amputate, injured limbs. But now, imagine that they can go actually into the body. They can go into the chest. They can go into the heart. And then, even in my time, they've changed it. You don't have to do many of these procedures anymore. The technology is more and more for less invasive procedures. The technology is so vast and coming on so quickly that no one doctor or one person can keep up with it. That's why we have specialists, and that's why we each have many have our own little niche in medicine. But this tells us what will medicine be like in the next 25, 50 years. That would be very interesting to see. But just in my time, I've seen tremendous improvements and changes in medicine. And the only other thing I'd like to say is for anyone who's interested in medicine as a career, there's nothing like it. It's one of the most satisfying professions. And I'm very blessed to I've been a doctor for many years.
Okay, thank you. We'd like to thank you for your time.
Well, you're very welcome. I hope it'll help. And again, I hope the Professor gives you an A+.
Thank you.